like to give a very brief introduction about how ketamine was found. Okay, so ketamine was found in 1962 by Dr. Kelvin Stevens, who was a chemist working at Park Davidson Laboratory. Okay, in 1964, due to human trials, ketamine's potential as an anesthetic was found, which led to it being approved by the US FDA in 1970. Following the approval, it was then used by the US military during the Vietnam War to treat their soldiers. This is because it has a safe application and it has minimal respiratory distress as an adverse effect. Not only was it used in humans, it was also used in animals as anesthesia in veterinary medicine. But ketamine faced a problem in 1980 to 1990 where it became a substance of abuse. This led to implementation of regulation to control the use of ketamine. Regardless, ketamine has been widely used in medicine up until today as a pain medication, psychiatric treatment, and also as an anesthesia. Okay, so now we're going to talk about how ketamine works in our body. So there are many theories as to how this works, but mainly it acts as an NMDA receptor antagonist. So it is a non-competitive NMDA receptor antagonist. So it blocks NMDA receptor, which disrupts glutamatergic neurotransmission. So this results to two things. One is dissociative effect, which is detachment of the person from their body and environment, which is what we know as K-hole. Next, there will also be altered brain region of sensory perception, which leads to three things: hallucination, disruption of perception of time and space, and also out-of-body experience.
Okay, good morning everyone. Today we explore the complex topic of ketamine tolerance and its various mechanisms. So, ketamine, known for its dissociative and anesthetic effect, is increasingly used in the clinical and recreational settings. However, when we use it for prolonged, it can lead to the tolerance where we need higher dose to achieve the same effects. Okay. The first one is neuroadaptation. Ketamine primarily acts by blocking NMDA receptor in the brain that is crucial for synaptic plasticity and memory. With repeated use and neurons adaptation by reducing the receptor sensitivity or numbers. This adaptation will diminish the ketamine's ability to block NMDA receptor effectively. Then, final result is that tolerance. Additionally, chronic use it can alter the neural circuits involved in moods and cognition. Further, it will reduce the ketamine's impact, which can lead to the brain adaptation. And then the second one is the metabolic tolerance. Long-term ketamine use can induce the liver enzyme responsible for metabolizing the drugs. This enzyme induction will increase the ketamine's breakdown rates and shortening its duration of action. And also, it can reduce the effectiveness over the time. Metabolic tolerance is a key psychological aspect contributing to the need for the higher dose to achieve the desired effects. So, we go to the third point, behavioral tolerance. Okay, when the individuals can develop behavioral adaptation to ketamine's effect, they may learn to function more normally despite ketamine use, which can mask some of its effect. This behavioral tolerance can contribute to the perception of reduced potency even when psychological tolerance is also present. So it can also lead to the tolerance also. And then we go to the fourth point, which is the cross tolerance. Tolerance to ketamine can generalize to other drugs that act on similar neurotransmitter system, such as NMDA receptor antagonists. This cross tolerance occurs because adaptive changes in the brain receptor and neurotransmitter system can extend to related substance. It highlights the broad impact of ketamine tolerance on pharmacological response. Okay, the last point is the psychological factors. So, psychological factors such as expectation of the drug's effect or the setting in which it is used. Also, it can influence the tolerance. Okay, over time, the individuals may develop psychological adaptation to ketamine's effect, which can alter their subjective experience. This factor can further complicate tolerance management and treatment strategies.
So next, ketamine will also develop dependence towards its users. So when the consumer use the ketamine for euphoric use, they will seek drugs to dissociate and also having hallucinogenic experiences. and this will develop cravings and also desire to use the ketamine to recreate those experiences to cope with their emotional or psychological stress. So the signs and symptoms of dependence will include compulsive users. The user will repeatedly and compulsively use the drugs despite the awareness of harmful effects. Next is neglection. The user will neglect all the personal or professional and also academic responsibilities due to the drug use. And also for psychological symptoms, the user will go through anxiety, depression, cognitive impairment and also psychotic symptoms like hallucination and also paranoia. So for physical health, it will lead to urinary tract infections such as ketamine bladder syndrome, which show the symptom of frequency in urination, pelvic pain and also sudden urgency. And it will also lead to liver damage and also gastrointestinal issues.
Hi everyone, I'm Husna. Now I would like to continue the presentation with the withdrawal symptom. Maybe some of you guys do not know why is the withdrawal symptoms. It's actually the effect that happens if we are suddenly stopped using the drug. So for this particular video, we are talking about the ketamines. So what happens if we are suddenly stopped using the ketamines? Here I would like to list out the withdrawal symptoms of ketamines. First of all is the nausea and vomiting, fatigue, and the third one is loss of motor skill, and the last one is agitation, which is the state of anxiety or nervous excitement. Now we move to the adverse effect of the ketamine. The first one is psychosis. Psychosis refers to the collection of symptoms that affect mind when there has been some loss of contact with the reality. The next effect are high blood pressure, memory problem, and also the bladder dysfunction. I would like to elaborate more on how ketamine affect the bladder. As we know, ketamine and its metabolite are excreted through the urine. And if there is prolonged exposure of the bladder's ureterium to these toxic substances, it can lead to a direct injury to the bladder. And this damage trigger an inflammatory response in the bladder wall, leading to the symptom of cystitis. When there is prolonged of inflammation on the bladder wall, then it can lead to the bladder dysfunction.
Alright, now let's have a look at the antidote for ketamine. Unfortunately, there is no specific antidote for ketamine toxicity. Thus, the primary approach involves supportive care. Critical monitoring includes assessing the patient's airway, breathing, and circulation. If airway compromise occurs, intubation can provide necessary respiratory support. Vital signs, particularly temperature, should be closely monitored to identify and manage symptoms like hypothermia. Benzodiazepines such as lorazepam, diazepam are effective in alleviating agitation, psychomimetic effects, hypertension, hypothermia, and seizures. For hypertension management, alpha-2 agonists like clonidine can treat or prevent ketamine's psychomimetic side effects and enhance the hemodynamic stability by lowering blood pressure. Beta blockers may also be used to treat hypertension and tachycardia. However, antihypertensive drugs should only be administered if the condition is severe. In cases where ketamine has been ingested, especially in large quantities, activated charcoal can be employed for gastrointestinal decontamination. Additionally, physostigmine can be used to address nystagmus and blurred vision. Overall, while the absence of a specific antidote for ketamine necessitates a reliance on supportive care and symptom management, prompt and appropriate medical intervention can significantly mitigate the adverse effects of ketamine toxicity. So, as a conclusion, ketamine abuse poses significant health risks including altered mental status, cardiovascular and respiratory complications, and potential for severe agitation and psychosis. Effective management primarily involves supportive care, vigilant monitoring, and the use of medications to alleviate symptoms and prevent complications. Due to the lack of specific antidotes, preventing ketamine abuse through education and appropriate medical supervision remains crucial. Continued research and awareness are essential to address and mitigate the public health impact of ketamine misuse. That's all from us. Thank you.